Have you ever experienced a strange symptom, like a persistent cough, unexplained fatigue, or a sudden change in your skin, and brushed it off as nothing serious? We've all been there, right? But what if those minor issues are actually early signs of something much more serious, like cancer? Cancer affects millions of people every year, and we know how terrifying that word can be. But here's the truth. Early detection can dramatically increase your chances of successful treatment and recovery. Unfortunately, many of us tend to ignore symptoms, assuming they'll pass or that they're just part of getting older. So, in today's video, we're going to uncover 10 cancer symptoms you should never ignore. Early detection can save lives, and it could save yours. Let's dive into the warning signs that might be trying to tell you something important. Number 1. Unexplained weight loss. Have you noticed that your clothes are fitting looser or you're dropping pounds without even trying? Unexplained weight loss can be one of the first signs that something might not be right, and it's a symptom that shouldn't be ignored. While it's normal to lose a few pounds here and there, sudden weight loss of 10 pounds or more without any changes to diet or activity levels could be a red flag. This kind of weight loss could signal a number of cancers, including pancreatic, stomach, esophageal, or lung cancer. Why does this happen? Cancer cells require a lot of energy to grow and multiply, so your body can start using up its own reserves, leading to unintentional weight loss. Additionally, some cancers affect the way your body digests food or absorbs nutrients, contributing to weight loss. Number 2. Persistent pain. Have you been dealing with pain that just won't go away? Whether it's a dull ache or sharp pain that lingers for weeks, persistent pain can be more than just a temporary discomfort. It could be a sign of something more serious, like cancer. Pain that persists over time and doesn't seem to improve with usual treatments or rest should always be taken seriously. Different types of cancer can cause different kinds of pain depending on the location. For example, a constant headache might be a sign of a brain tumor, while abdominal pain could point to cancer in the liver, colon, or pancreas. Why does this happen? As tumors grow, they can put pressure on nearby tissues, nerves, or organs, causing persistent pain. Cancer can also affect the body's ability to control inflammation, leading to discomfort. Number 3. Skin changes. Have you noticed any unusual changes in your skin lately? Whether it's a new mole, a rash that won't go away, or changes in the texture or color of existing spots, these skin changes could be an important warning sign that should never be ignored. Skin cancer, like melanoma, often begins with subtle changes to your skin, such as a mole becoming larger, darker, or irregularly shaped. Other signs may include itching, bleeding, or the appearance of new growths. Even non-skin cancers, like breast, lung, or internal cancers, can sometimes manifest through skin changes, such as yellowing of the skin, jaundice, or a rash. Why does this happen? Skin changes can result from cancerous growths affecting the body's immune response or the direct impact of cancer on organs, causing changes that are visible on the surface. Number 4. Fatigue. Feeling tired or drained is something we all experience from time to time, but when fatigue becomes constant and doesn't improve with rest, it might be trying to tell you something important. Why does this happen? Cancer can use up a lot of your body's energy, whether it's due to the cancer itself or its effects on the body. Your body might be working overtime to fight off the disease, which leaves you feeling constantly exhausted, no matter how much you sleep or rest. So, while fatigue can be a symptom of many different conditions, it's a warning sign that shouldn't be ignored, especially when paired with other unusual symptoms. Number 5. Changes in bowel habits. Have you noticed any sudden changes in your bowel habits, like persistent diarrhea, constipation, or a feeling that your bowel movements aren't complete? Changes in bowel habits, especially if they last for weeks or are accompanied by other symptoms, can be linked to colorectal cancer or other types of cancer affecting the digestive system. For example, colorectal cancer can cause a narrowing of the colon or rectum, making it harder for stool to pass normally, resulting in constipation, bloating, or even blood in the stool. If you experience sudden or drastic changes in your bowel habits, especially if you have other symptoms like unexplained weight loss or blood in your stool, it's important to get it checked out. Number 6. Changes in bladder habits. Have you noticed any changes in your bladder habits recently? Maybe you're feeling the need to urinate more often, or perhaps it's become more difficult to go, even when you have the urge. These changes might seem small, but they could be a sign of something more serious, like bladder or prostate cancer. Frequent urination, pain or burning during urination, or the feeling of not being able to empty your bladder fully can indicate an issue within the urinary system. In women, these changes could point to bladder cancer, while in men, they may signal prostate cancer. Moreover, blood in the urine or changes in the color of your urine, whether it's darker or has a reddish tint, should never be ignored, as it can also indicate cancer. Number 7. Fever. Fever is your body's natural response to infection or inflammation, but if you're experiencing unexplained or persistent fevers that don't seem to go away, it could be a sign of something more serious, like cancer. Certain cancers, like leukemia or lymphoma, are known to cause persistent low-grade fevers, and in some cases, they can be accompanied by other symptoms like night sweats or unexplained weight loss. A fever that occurs without any obvious reason, such as an infection, could signal that the body is fighting cancer, as tumors release substances that trigger fever responses. Number 8. Persistent cough. A persistent cough is something most of us experience from time to time, often due to a cold or allergies. But if your cough sticks around for weeks, doesn't seem to improve, or gets worse over time, it could be a warning sign of something more serious, like lung cancer or throat cancer. Lung cancer, in particular, often presents with a lingering cough, wheezing, or chest pain. Sometimes the cough may be accompanied by blood or mucus. It's easy to dismiss a chronic cough, especially if you don't have other obvious symptoms, but if it persists for weeks, it's important to have it checked out. Throat or lung cancers can cause irritation and inflammation in the respiratory tract, leading to a persistent, unrelenting cough. Number 9. Shortness of breath. We all get winded from time to time, whether it's after a brisk walk or climbing a set of stairs. But if you're feeling unusually short of breath, especially when you're not exerting yourself, it could be a warning sign of something more serious, including cancer. Shortness of breath is commonly associated with lung cancer, but it can also indicate other cancers that have spread to the lungs or surrounding areas. As cancer grows, it can interfere with the body's ability to properly exchange air and oxygen, making it harder to breathe. This can lead to feelings of tightness in the chest, difficulty taking deep breaths, or even feeling out of breath during everyday activities. Number 10. Mouth changes. Have you noticed any unusual changes in your mouth, such as persistent sores, a white or red patch on the gums, tongue, or the inside of your cheeks, or even difficulty swallowing? While these symptoms might seem harmless at first, they could be signs of something more serious, including cancer. Mouth changes, such as unexplained sores that don't heal, bleeding, or a persistent sore throat, are often linked to cancers of the mouth, throat, or tongue. Leukoplakia, the white patches, or erythroplakia. Red patches are commonly seen in the early stages of oral cancers. These changes may appear gradually, but if they persist for more than 2 weeks, they should be examined by a doctor. And there you have the 10 cancer symptoms you should never ignore. Remember, early detection can make all the difference. If you notice any of these signs, it's important to speak with a healthcare professional. Thanks for watching, and make sure to like, share, and subscribe for more essential health tips.